everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to continue talking about saccades. We're going to be going over part 2, which is treatment exercises for impaired saccades. If you haven't seen my other video, saccades part 1, I go over how to assess if saccades are impaired. I'd recommend you take a look at that first. Now remember, the definition of a saccade is the ability for the eyes to jump from one target to another without any errors. This is very functional for us. We use it when we're reading, we use it when we're driving, or even scanning our environment. Let's talk about treatment concepts. If you're finding that one eye is more impaired than the other, it's good to train that eye by itself before moving on to exercises where you would be training saccades for both eyes open. We want to train from large to small saccades. So that's going to be in contrast to smooth pursuits, where we would be training small to large. So remember, saccades, we're training large saccadic movements to smaller saccadic movements. For any visual rehabilitation program, I usually recommend having them practice about 20 to 30 minutes total a day. So if they have more than one exercise that they're doing, maybe for smooth pursuits or range of motion, and including saccades, we're going to be doing that for a total of 20 to 30 minutes a day, not just 20 minutes of each exercise. We're going to be splitting that into multiple bouts throughout the day just to make it easier and more practical, and hopefully they'll have less symptoms that way. Early on, when people are just getting started with visual rehabilitation exercises, I usually have them just try the exercise for 30 seconds to 1 minute bouts at a time. If their eyes are feeling tired, then they can rest between bouts. They can even rub their palms together so it's a little warm, close their eyes, and just kind of press their palms onto their eyes. It's called the palming technique, just to help them feel less fatigued and for the next exercise. So one of the exercises that I first start with is called door dots. I usually have them sit in a chair facing a door to where they can see all corners of the door without moving their head. I use a Post-it note and I put a dot on each Post-it note and I put it in each corner of the door, so there's 4 of them. And what they can do is practice jumping their eyes, or one eye at a time, from each dot to another. They can go along the frame of the door, so here, 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 and go that way. If they need to just work on horizontal, they can do horizontal, they can do vertical, and then they might be able to progress to diagonal. Now, diagonal jumps, they tend to give people more symptoms, so I wouldn't start with that first. All right, another exercise is card scanning. So if you have a deck of cards, you can have them sit at a table, scatter the cards on the table, and have them look for different suits or different numbers. You can say, okay, find all the hearts, find all the clovers, find all the 10s, things like that. Another exercise I learned from a course is called yardstick saccades. You'd get a yardstick and you'd put different colored dots or circles on intervals throughout the yardstick, and you'd have them sit about 16 inches away from the yardstick. You can use a real yardstick, or you can even put a piece of tape on the wall and use colored circles there. That's fine too. And what they would want to start with is jumping their eyes from the 2 outermost circles, so we're working large to small. Outermost circles back and forth, make sure their eyes are jumping straight to the other target and not getting distracted by the circles in between. And then as they progress, you can move inward and work on smaller and smaller jumps. To progress these exercises, we can also work on scanning worksheets. So these are worksheets with rows of letters, and at the beginning of each row, there's a designated letter that they have to find within that row and cross it out. So this is an example of one. And as you can see, this is actually a patient of mine did this, and for some reason did erase it, and now it's kind of nice to be able to use as an example. I tend to use this a lot, so I laminated this one and I have them use a dry erase marker so I can take a look at the result, erase it, and use it again for someone else. There are many different ways you can assess this. You can time how long it takes for them to go through an entire page, an entire row. You can even grade it by how many errors they have. There are many different ways that you can do this. Another option we have is called a heart chart. This is probably going to be easier to show in a demo. So this is a sample heart chart. You can see that there are rows or columns of letters and numbers. I would place this about 6 to 10 feet away on a wall at the person's eye level. If they're working on just one eye at a time, then of course you have them cover the other eye. And the goal is to jump your eye or eyes from the leftmost column to the rightmost column, saying the letter out loud and then working downwards. So an example would be if I cover one eye and I use my right eye and I say Z, U, H, M, I, O, etc. So you want to make sure that there's no head movement, and if you want to progress this, then you can move inward. So you can use the second leftmost column and the second rightmost column moving downward. An example would be like this. 2, A, N, A, 5, 9, etc. This is going to be more difficult because they're not going to be able to use the borders of the chart to determine where their eyes are supposed to stop. Don't forget, we also want to work on vertical dimensions as well as diagonal. Again, diagonal tends to give people symptoms, so make sure that's not the first thing that you give them. You can also progress the position that the person is in, so they can start out sitting, which is preferred because you don't know how they're going to react, if they're going to get dizzy. And you can progress to standing, you can progress to narrow base of support or tandem or single limb stance. Let's talk about ways to do advanced exercises for saccades. Again, you can still use the heart chart. You can have them stand on foam. You can even have them at a cognitive task. So maybe they have to say the letter and then also say a corresponding number, maybe a sequential number. So an example would be, if they cover their eye and they say Z, 1, U, 2, H, 3, M, 4, I, 5, O, 6. Something like that. The beginning numbers are usually pretty easy, but as they get further and further down, it gets more challenging. You can also have them start working on reading. You can have them scanning for certain color objects in a room. To make it more realistic, you can even have them add in head movements. You can have them scan for items at a grocery store. You can have them do these activities holding a cup of water with different amounts of water in it, making sure they don't spill. They can hold a backpack or a grocery bag. There are just countless ways that you can modify and progress these activities. Make sure that when you're thinking of activities and exercises for each person, that you're keeping function in mind and tailoring it to their needs. So if they like to read, make sure that you're working toward reading. If there's a need, work on reading a bill or a receipt. You can have them sit at a table with their bill and use their eyes to look for the correct name, the address, the amount that they owe, etc. So hopefully by now you see that there are many options for visual rehabilitation exercises that allows you to just have a little bit of fun and be more creative. That's all for this video. I hope you enjoyed it. If you did, like and subscribe. See you next time.